Greetings, everybody. So I'm going to call the meeting to order. It's 5:32. It seems like we do have a quorum. So can we do a quick roll call?
All right. Can you hear me? Can you hear me? No? Okay, sorry. All right, we'll try. Steve Bischoff?
Yes, here.
Okay, Helen Burks?
Here.
Marisol Cantu? I believe sent in excused absence. Eddie Chacono has also resigned from the task force, so he is no longer a task force member. Luis,
We can't
I'm not
hear
sure
you.
if I can. Okay, so Eddie Chacon has resigned from the task force, so he's no longer a part of the task force for roll call. Luis Chacon also sent in an excused absence. Don Gosney?
Here.
Randy Joseph?
Here.
Kristen Killian Lobos?
Here.
Armand Lee is also sent in an excused absence. Laura Mangles, I think also is absent. Yeah, she's been off, right? Oh, sorry. Yeah, sorry. Leah Murray is also has an excused absence. Sorry about the mic. Marcus Engesing?
Here.
Jamin Purcell?
Here.
Joey Schlemmer?
Here.
Deborah Small?
Present.
Ben Terrio is not here, but I know he said he was going to come in 10 minutes late. Tamisha Walker?
Present.
Linda Whitmore?
Present.
And BK Williams.
Present.
So we have a quorum for our meeting tonight with
Just
12 task force members present.
I'm sorry, I just wanted to, you said something about Ben. I didn't hear what you said.
Oh, he is not here at the moment, but he did let us know that he was going to be here 10 minutes past, so he might be here in about 5 minutes or so.
Okay, fine,
Yeah.
thank you. Okay, so agenda review and adoption. Is this on? I can't tell. You can hear me?
Yes.
Okay, great. So, has everyone had a chance to review the agenda for the meeting tonight? Does anyone have any suggested changes to the review, to the agenda as presented? Any objections to adopting the agenda as presented? I see no hands risen and objections, so the agenda is adopted. So the next thing is reading the meeting procedures.
All right, so I will now read an announcement to the public. Anyone may make an oral comment, even if a written one has been previously submitted. However, each speaker may only raise their hand once to make one oral public comment per agenda item. We will hold public comment very shortly after item F, City Staff Liaison Reports. So if you would like to speak during public comment, please raise your hand, or you can wait until we call for public comment. For agenda items under item H, presentations, discussions, and action items, you may let us know that you are interested in providing verbal public comment for each agenda item. An announcement will be made when it is time for that. So we can move on to item E.
Thank you. So the next item is approving the minutes of the July 12th, 2023 special meeting of the task force. I'm accepting any motion to approve the minutes.
Randy Joseph seconds.
Okay, so that's Steve Bischoff and seconded by Randy. Any discussion? Not seeing any hands raised. Let's call the question, please.
Yeah. Steve Bischoff? Helen Burks?
Aye.
Don Gosney?
Aye.
Randy Joseph?
Yes.
Kristen Killian Lobos?
Yes.
Marcus Engesing?
Aye.
Jamin Purcell?
Aye.
Joey Schlemmer?
Abstain.
Deborah Small?
Aye.
Tamisha Walker?
Aye.
Linda Whitmore?
Aye.
And BK Williams?
Abstain.
Okay, so the motion passes with 10 ayes, 2 abstentions, and it has, I think, it has to be a majority of the quorum.
Yeah,
No?
people present. No, it has to be, we've gone through this. It's a majority of the people at the meeting.
It is.
Before we get over the meeting, do we have any air conditioning in here? Nothing
No, this is an older building. If anyone wants to help with a capital campaign, we will take funds.
Didn't hurt to ask.
I think we have a fan blowing somewhere, so we apologize.
I've got there, what is it, much cooler than the schools, y'all. Yeah. Much cooler, like 20 degrees cooler than the schools.
Next item on the agenda is city staff reports.
Good evening, everyone. LaShonda White, Deputy City Manager for Community Services. Feels like it's been a long time, but welcome back. We just saw each other last month. Hope everyone had a great summer. I don't have many announcements, just that the first City Council meeting since July, so 2 months for us as city staff, will be on September 12th. So the next item that will be before you during presentations is one of those items that should be before City Council, but it'll be a full agenda. So I hope you all can check out the agenda and see if there's interesting items on there for you. Also, upcoming in the next few weeks, you will hear more information or see more information about our biannual community survey. So we do a community survey every 2 years where we ask selected households, over 3,000 households, to partake in a survey. And we ask questions about city services, what they think, what recommendations and priorities they have. So it is scientifically, the households are selected by a firm that we contract with, and they have developed the survey questions. They survey jurisdictions all over the United States. And so we do that as phase one. So just the selected individuals, households get to take the survey, but then we open it up to any Richmond residents to take the survey. And we use those survey results, we present them to City Council, to our senior staff, our department directors. We have them up on our website. We will share information with boards and commissions as requested and other community organizations. And we use results in outreach that we do. We use results in grant applications. So just letting you know that should be coming out soon. So keep an eye open for that. We are doing some website updates for the city to make our website more user-friendly. So be on the lookout for that as well. Lupe or Stephanie, any updates? No? All right. Thank you. Oh.
Yeah, I have a question. So my question for you is whether you know if the Community Crisis Response Program report is going to be on the agenda for the next City Council meeting on September 12th.
It is currently on there.
Okay.
But if you all have watched City Council meetings, it will depend on if it gets heard, depending on what else is on the agenda, how long things are taking. But because it was held over from the July meeting, it is already automatically on the agenda for September 12th. And the agenda hasn't been published yet. And so that always is subject to change after city staff meets with the mayor. But as of right now, yes.
Okay, thank you.
You're welcome.
Debbie, it's very difficult to hear you.
LaShonda, when will the agenda be posted?
Agendas are posted the Thursday. It has to be posted by the Friday at whatever, it's 72 hours before the start of the city council meeting. So sometimes council meeting starts at 3, 4, or 5, depending on when closed session starts. Usually it is Thursday afternoon.
Okay.
Before the 12th. So I don't have my calendar in front of me.
Okay, thank you.
You're welcome.
Any other questions for city staff before we move on to the next item? Okay, so then the next item on the agenda is actually public comments.
Okay, if anybody would like to make a public comment on an item not on the agenda, please raise your hand now. You will have 2 minutes to speak. It looks like we have no public comment.
And there was nothing submitted in writing, right?
I will check right now. I forgot. I'm sorry.
Oh, God, this is heavy. Oh, shit. Oh, my God.
Hey everybody, just letting you know there's a cool community event coming up this Sunday, Soulful Softball Sunday, happening in Nickel Park. First game I think starts at 10 a.m. There'll be some things going on earlier. There'll be a lot of different community organizations, a lot of community coming together. I recommend you come out. Also, all the WCC USD schools are hiring. If you know anyone who's ever wanted to work with young people, you can reach out to the HR website. There's sub positions, you could do it 1 day a week positions. I just have to say that because our youth safety, having adults around them who know them well, who are good for them is a big piece. And I would argue that our teacher vacancies are a big safety issue in our community right now. Thank you.
Okay, so we do actually have one emailed public comment. I'm going to read it into the record. The public comment is from Cordell Hindler. Good day, Chair Small, Task Force members, and staff. I am forwarding the following comments into the record. 1, the task force is invited to the Baltic Kiss anniversary party this Friday at 6 p.m. hosted by the Point Richmond Business Association and Richmond Chamber of Commerce. 2, the Rosie the Riveter Annual Gala, September 23rd, 2023, 5 to 10 p.m. at the Craneway Pavilion, $250 per ticket. 3, I am working on a project in relation to the community task force, and I will share it at a later date. Sincerely, Cordell. Okay, are there any other public comments? All
I
right, that
see
will-
your hand up, someone back there.
Oh, I'm sorry.
Wait, you have to get a, you have to, go ahead and
Need a
get
mic-
a microphone.
Being recorded.
Good evening, everyone. I just want to announce that Youth Work will be closing our application at the end of this month for the work experience because as of today, we have over, I want to say 794 applications that we just opened in July for this new fiscal year. So we just need to kind of like look and pay attention and try to reach out to those young people. And if we're able to and still have money by January, we will reopen at that time. So yeah, notice we'll be closing our application August 31st.
Well, congratulations, and thank you very much.
Thank you. Are there any other public comments? Okay, I think that will end this item. Thank you.
Okay, then the next item on our agenda is to receive an update about the community no, that was from the previous, I'm sorry, I'm looking at the previous one. Okay, great. Discuss the draft report on the Community Crisis Response Program and approve recommendations.
All right, well, good evening, everyone. With us on the phone via Zoom, so it's audio only. Ann Jenks, can you hear us? We tested it earlier.
Yes.
Oh, you're there, all right. Is David on as well? No?
I do
Okay.
not.
All right. So thank you, Ann. Ann is on the East Coast, enjoying what I hope is her best life right now. And, but we wanted to make sure we were able to provide an update, answer questions, have a conversation about the Community Crisis Response Report that Urban Strategies Council developed. This was submitted to the task force in July. It was also submitted to City Council for review. So I hope everyone has had an opportunity to read it, and we did have a few questions that came in, one from a community member as well as one from a task force member. And so if anyone does not have this hot off the press draft question and answers that were drafted by Urban Strategies Council in terms of the answers, please raise your hand. We'll make sure we get you one. And so with that, even though last month we had a very brief presentation, there wasn't a lot of time to go over the presentation. So Ann can't see the presentation. Ann, I hope you have it up in front of you, but I will start And you can chime in, because I've heard this presentation a lot. So if, Stephanie, if you could pull it up for me. Oh, and David Harris is not feeling well, so I'm definitely happy that Ann was able to join us from the East Coast, so thank you, Ann. All right, next slide. I am not Urban Strategies Council, but I will speak on their behalf for a moment. We did contract with them via City Council approval. They were founded in 1987, and they do work all over the Bay Area and have done a lot of work around community crisis response programming in both Oakland and in Antioch. But you can see some of the different focus areas that they do work in. Next slide. So for the development of the Community Crisis Response Report, there are different phases in this work. We really wanted to make sure the Urban Strategies Council talked to community and heard from individuals about their experiences with the 911 system, as well as their needs, unmet and desired needs around community crisis. And so we did a number of different things, and I think they did a really wonderful job. We had surveys that were done, that were paper surveys that were passed out at every single event that we could think to go to, and Ann was wonderful, showed up at events I didn't know she was showing up at. There was also online surveys available. We passed information out we went to events, we shared things through our weekly report, we emailed every community-based organization that we knew of to be able to ask them to share information. And so we really tried to get information out about community crisis response to educate people, but also to get information back from individuals. And the survey was done in 5 languages. We also did 9 focus groups and held 2 community forums. And the focus groups were able to go more in depth and ask more detailed questions and help to understand some whys about why people felt the way they felt. And then Ann and David also did a number of interviews with elected officials. Every single city council member, along with the mayor, had an opportunity to meet with Urban Strategies Council. They did some select interviews with community-based and civic organizations and reached out to businesses and others just about their experience to gather information. Ann, is there anything you want to say about community engagement?
No, I think you covered it. I just think that also really getting a deep understanding from a broadly defined set of stakeholders was really important, especially given the level of interest in how CCRP would interact with A3.
Thank you. Next slide, Stephanie. So that's what we did, and then here are some of the things that were discussed during those conversations and surveys, just seeing if there was community support around it, where were people receiving information. Always like to, in Richmond, talk about assets and really celebrate what we're doing well, but also have an opportunity to talk about barriers to access and things that we can do better. Next slide. And so here, the next few slides just tell you about some of the individuals, some demographic information about some of the individuals that answered the survey. So we received 415 responses. Obviously, we have 115,000 people in the city of Richmond, so this is not everyone. This was not a scientifically done survey, so it's not responsive in that way to all of Richmond, but we still got a really great number of survey responses, and so this just shows you the age ranges of individuals who were more prone to answer this survey, and you can see that the largest group were 35 to 44-year-olds. Next. And then we looked at it by race, ethnicity, and we have 32% white Caucasian, then down to 27% for Latinx community. African American community comes up third, and then you have Asian American community at 9.1%. Next slide. Gender orientation, the majority of individuals that responded were females, and then males, and then we gave individuals opportunities to specify how they define themselves. All right, and before I move on to community response elements that are outlined in the report, do you have anything else you want to say about the survey results?
I mean, I think overall, we kind of monitored survey results as they were coming in terms of who was reflected. There was a strong interest in the task force and in the city to make sure that people who might be less inclined to engage with surveys were engaged with. And I think that we did that successfully. Please don't ask me why men won't fill out surveys.
They did, just
More.
not at the same rate as their female counterparts. All right, thank you, Ann. Next slide, community response element. So a few things that kind of rose to the top and that people talked about and were interested in or concerned about, that the community crisis program will respond to a broad range of calls and not solely just mental health ones, that this service would help residents access resources that are available. That was really important, making sure we are connecting people to the services they need to get the help they need to live their best lives. The question around, is engagement in community crisis response program voluntary or non-voluntary or involuntary? And that it's very clear that engagement in this program is voluntary and people have the ability to make decisions for themselves about what services they want to access and what help they want. People talked about the need for this program and the individuals and teams that were recruited, that they looked like the communities that they're serving, culturally competent, and that really met the needs of the different neighborhoods within the city of Richmond. We really need to make sure also that the jobs that are provided in this work are really honoring the work that is being done, and that they acknowledge with pay that this is challenging work and we really want to have a successful group of individuals who are interested in this work to be on the team. And that, of course, they talked about that teams should be experienced, but experience can be just lived experience. It doesn't have to be that people are professionals or have degrees, advanced degrees, and that we need to make sure training is provided. So those were some high-level things that came out of the survey. Anything else, or what people were saying, anything else, Ann, that you want to share around response elements from the community?
Yeah, I mean, the issue around engagement being voluntary, first of all, a lot of times people in Richmond were asking, well, then that means that, crises aren't going to get resolved. And I do want to say that what you see in programs is that responders get very, very good at getting people to engage. So just because it's voluntary doesn't mean that 50% of the time people are not engaging. The vast majority of the time, people do engage voluntarily, and because the crisis isn't going to go away without resolving it, but also that is a crucial element in the safety of the teams, because people understand that you can interact with the team, and at no point, are you going to lose your ability to make decisions?
Thank you. Next slide, Stephanie. So this is about common calls that could be dispatched to an alternative response team. So these are just examples, and this is based on promising practices. This came from Urban Strategies Council, things that they've seen in other jurisdictions. So as you can see, a lot of questions came up also about that overlap between the county's A3 program and what this program would do. And this shows you that there is a breadth of different types of calls that alternative response team could respond to that are outside of behavioral health calls, which is what A3 responds to. So just some examples: welfare checks on individuals, noise complaints, and maybe some neighbor conflicts are a few examples. Anything here, Ann, around types of calls?
So, I mean, I just think it's important to emphasize that even within a type of call, there's still a safety assessment and just an appropriateness assessment that's happening probably within dispatch, having, when the CCRP and dispatch and police and fire have all kind of worked together to understand what are appropriate protocols. So a noise complaint might be very, very appropriate to CCRP, or it might really not be appropriate to CCRP, where dispatch calls up the address where the noise complaint is happening, sees that there are noise complaints there 3 times a week, that there have been, unregistered guns there previously, there's been, I don't know, some other kinds of violence at that address, and that likely wouldn't fit within the protocol of the type of call that you send CCRP to, right? But another noise complaint is literally a child's birthday party and a neighbor who works at night and wants to sleep during the day, right? And that's a conversation that you really can work out appropriately. So it's not like it's just that you've got these calls coded and then you send CCRP. You're still doing an assessment of the situation and going through protocols in terms of how it's being dispatched.
Thank you, Ann. Next slide. So this is from information collected, just some high-level things about when we asked the question, what would make Richmond's emergency services better? The bolder, bigger the response tells you that more people gave that as a response. And so just to read them, improve de-escalation, improve response arrival time, increase routine patrol, improve cultural sensitivity, more focus on keeping residents safe. Next slide. When we asked the question, do you support the program, where well-trained community members respond to some appropriate situations instead of police, we had over 87% of the survey respondents saying yes. Next slide. Before, Ann, we go into the options that Urban Strategies Council developed, did you want to say anything else about what you heard, saw from residents, or should we just go right into options?
I mean, I do think that it's worth mentioning the task force, and I can't totally prove this, but there's always very, very strong support for an alternative emergency response concept. But the level of support in Richmond really was notable. You were over 10% higher than the same survey in Antioch, where people were also very, very supportive. And I suspect that is the result of the work of the task force and the level of education and knowledge that community members had in Richmond. Because there's really no other explanation about why Richmond is so significantly higher. And we found that as well just in conversations across a very broad swath of Richmond as those conversations. It was just a really surprisingly high level of knowledge and kind of engagement with the discussion. It was very, very impressive.
Thank you, Ann. So in the report, they talk about all the input and information gathered through resident responses, as well as best practices and what learnings have happened, and just other documents that the city has developed. And then they came with some implementation options. And so this slide and the next slide are very similar. So I'm just going to go to the next slide, please. All of these say number 1, but they should be 1 through 5, and they are not in order of priority or what we think will be the most successful. This is just the order that they came in. So one option for a potential structure, so that's what we asked Urban Strategies to do, is say, based on Richmond's needs, based on what Richmond looks like, and what do you think could be a possible structure to implement a community crisis response program here? So we knew we were going to implement something. We didn't know exactly what it was going to look like, and this is where we need City Council to make a decision. So one option, which is very similar to what Antioch has done, is they have issued an RFP. We can issue an RFP, a request for proposals, for an independent nonprofit agency organization to run the program. So if that was what our City Council decided to do, then the city, with the help of Urban Strategies Council, and they are still on contract with us to provide additional support in the implementation phase, would help draft a request for proposal, and we would release it and get a qualified nonprofit organization that can do this work to come into Richmond and actually hire the staff and help with the training and do all of that and manage the program, once again, as an example of what's done in Antioch. Another example would be, the next two are really around creating a new department and having it be within this program to be instituted within the city of Richmond. And so the difference is we would embed it within an existing city department, and another one is that we would create a brand new city department. But that's the only difference between those next two. But this one would look like it would be a City of Richmond run program where every single staff person that would be hired to do this work, from the lead person to all the team members, support staff, would be City of Richmond employees. So that means we would have to create job classifications and go through our whole process with our personnel board and city council, creating, like I said, job descriptions and classifications, as well as setting salary schedules. If we don't have existing classifications that meet our needs to do this work, we have to put all that, put that out and go through our hiring process. And then we would have to figure out where would this program sit. So they just mentioned a few ideas of where it could sit based on our current structure, but also based on what has happened in other jurisdictions. And if we did a whole new department, then we would create a new department, such as the Department of Social Services. I'm kind of making that up a little bit. So that's another example. The other one would be some sort of nonprofit hybrid model where you would start the implementation, the pilot, by hiring a nonprofit organization with plans to turn it over to the city. So let it get off the ground with a nonprofit, knowing that eventually the city would take over the program and have it be embedded within a city department. And then finally, we have not had conversations with Contra Costa County about this, even though they've seen the report, is to figure out if there's some sort of partnership where we don't run the program, we somehow figure out how to work with Contra Costa County to do something. And so those are the 5 options there. And then go to the next slide really quick. And so this was, Urban Strategies Council, city staff, taking into account what we heard from community and sitting down and just kind of ourselves thinking about what possibly are some pros and cons to these 5 different options. And once these are draft, these are our initial thoughts based on input, that in terms of these 4 categories: implementation speed, how quickly could we get the program up and running, how much would it cost, how sustainable would this program be, and then community support. We did some internal ranking. Once again, these are our recommendations. Someone else could come up with very different thoughts about this, and so we took each one of these individually and just thought it was a good starting place for a discussion. This is not the end-all be-all, but the thought was, for implementation speed, it's easier and quicker for a nonprofit, as an example, to get a program up and running than if the city has to hire a number of staff and create a brand new department. So that's an example. As you can imagine, the cost for having something be within the city, we have high salaries, and benefit load is 80 to sometimes 100% for positions of the salary cost. And so having it be a city department is high. So that's an example of what that means, where 1 is low, so more cons than pros, and then 3 is that it's more pros than cons. Oh, yes.
Yeah, I just have a question about the ranking that you assign to certain things.
Can you get closer to the mic? Or?
Yes, can you hear me? I'm assuming the mic is working, is as close as I can get. My question is about the ranking of cost, in that the underlying assumption is that a higher cost should have a lower ranking. But if the higher cost is because people are getting paid better, that doesn't necessarily, to me, imply a lower ranking for the program model. So I have to really question who was doing the ranking and what was the basis on which you were making these decisions.
So thank you for that. And I tried to preface by saying this was Urban Strategies Council and myself and like Patrick Seal sitting down and just having a conversation about it. And I said, this is only our thinking, and your ranking could be 100% different than what we came up with, but this is a starting point for a conversation. And in the report, there's more information about like why our thinking was that way. And so I completely understand what you're saying, right? It is, when we're looking at it, it's the cost to implement versus another category could be wages or job security, or it could be a different category. So that's what we were looking at, was the cost to implement. It's just higher.
And the reason I bring that up is because I'm assuming that when you were making the rankings, that you were looking at the task force's priorities that were included in our proposal in terms of what we thought was important when we presented it to City Council. And one thing that was important was making sure that the people who were staffing this would both be community-centered, but also be given living wages, that they be paid on par with city workers. We weren't trying to create a pool of substandard in terms of wages, people running the program, and that was an important part of the program design. So I'm just curious about how much of what you did here also included and referenced what the task force had laid out.
I hear you. So if we look at sustainability and community support, you can see that having it be within a city department is higher, right? So we talk about there, if it's in a city department, you are going to have city staff or people who are hired have a higher salary with a great benefit package, and so having less turnover. So we just maybe put it in a different category than where you may want to put it. We looked at costs as just what is the dollar amount. So it could be a difference, and I don't have that dollar amount in front of me, but it is substantially what it costs for city staff is just substantially higher than usually what the benefit cost is, as an example, for nonprofits. And I think Ann also wants to share something about options.
Well, I just really appreciate that this is such a focus of the task force, because not only is it the right thing to do, it's the right thing for the program to have staff that really can turn this into a career and can become exceptionally good at doing this job, and can stay. So, I mean, I really appreciate that this focus, and it's something that I always am pushing very hard for. And I don't think that the assumption is that if it's a nonprofit, the nonprofit is just randomly deciding how much to pay people. It could be prioritized within the nonprofit, and the assumptions about costs were even assuming that the nonprofit was turning these into decent jobs, as has happened in Antioch. So it wasn't, these are going to become minimum wage jobs, because you will not have a successful program, and it's not the right thing to do. So, that was not part of the assumption. Although obviously the city benefit package is better, and probably it would end up being a better job if it was a city job.
Okay, go to the next slide. We just have a few more slides. This is around budget projections, because we know people care about dollars sometimes. No, that's not all that matters, but we wanted to give a little more. This gives to that cost piece. And so just so you all know, there is numbers included in the report, and they're tentative, right? At the time that the report was written, class and comp for the city of Richmond is still not fully implemented. Therefore, we anticipate higher costs for salaries in the future for specific jobs. We also don't have classifications defined yet, so we don't know if there's an existing classification with a salary range or if there are new classifications that we'll need to do. So these were assumptions. We came up with dollar amounts and costs based on assumptions that we tried to outline and clearly articulate so that people could know what these numbers were based on. And so this is, in terms of the assumptions, they're tentative, they're not final, because we have to do operational decisions. Also, this is based on the fact that staffing would be 24 hours a day, 7 days a week, which equates to 14 full-time equivalent positions. And the classifications, the numbers are based on projected average annual salaries for each position based on similar classifications that currently exist within the city of Richmond. So here are just some estimated salaries. So we would have a program manager. This is the cost. Talk about urban strategies. These are urban strategies recommendations for the staffing. Go ahead, Ann.
No, I'm sorry.
So these are just the positions. You have a program manager, an administrative or data analyst that they believe could be part-time, a community crisis responder, and there'll be multiple of that position, multiple EMTs, and a mental health clinician. So those are the 5 classifications, not with some of those classifications having multiple, and these are placeholders for positions. And do you want to say anything about those classifications or the makeup of the 14 FTEs?
No, the average wage for EMTs in the Bay Area is, I think, in the mid-50s at this point. So the goal, no matter who the employer is, to make these much more sustainable jobs. And then the other piece is just to ensure that you are in fact hiring people who have a deep knowledge of the communities that they're serving. And that you actually hire these positions. That's the other important thing.
You're the chair. You can call on yourself.
I'm a little confused. This is Deborah Small speaking, Ann. I'm a little confused because in the report, you say that you're not relying on having an EMT as a principal responder. So I'm not clear why the EMT position is included in the pilot, because in the program design, they're only talking about using the EMT to help develop the protocols and to manage stress and to support the team. So that to me suggests, one, that you don't necessarily need a full-time EMT, and you may not need that as part of the initial program design. So that's why I'm confused.
Okay, Chair Small, I think that there's a confusion between the EMT and the clinician position.
Okay, got it.
It's the mental health clinician position that we're saying doesn't necessarily have to be full-time. If you have a two-person team, having one person with a little bit of just basic medical knowledge can be very valuable, especially when you're engaging with people who may have faced substantial barriers to getting health care. It's not replacing EMS or anything else. It's just somebody who, can help somebody who has swamp foot or who has wounds that need to be redressed. And I think it is very beneficial. It may or may not end up happening in Richmond, but it is very beneficial to have somebody with the most basic level of medical knowledge. And that's the EMT.
So those are 2 separate functions. One is to provide, as I'm hearing you, the EMT is to provide basic hands-on medical support services that are needed in the moment, and the mental health clinician is specifically to advise on mental health-related issues.
Absolutely, exactly. You have 2
Okay.
people, and the goal is for the EMT to be part of the team. So it's not like the community crisis responder is doing all of the crisis response, and then when a medical issue arises, the EMT pops. They're a team that's working together to respond to crisis. It's just that the EMT has this extra knowledge base that can be very handy, if that makes sense.
All right, thank you.
Thank you. And I don't know, Ann, if it's similar to, as an example, all of our firefighters, like that's our classification, all firefighters, but they all have EMT, like they have the EMT license. So I don't know if that, we would call them EMTs or if they would be called something else and they would have that extra skill set.
The EMT basic is the lowest level of medical knowledge that gets certified in California or most other states. I think that some of your firefighters are also paramedics, because that's pretty typical in firefighting, just so that they can respond to a higher level of medical crisis. But it's the lowest level. It doesn't mean that it would be a very different job than the firefighter EMT, the community crisis responder EMT.
Thank you, Ann. Next slide, Stephanie. So this is just another where we add things together, where we have our 14 FTEs, and we show, once again, we have assumptions based in here so you can understand what those are. So if any of those assumptions change, then our numbers change. So we're trying to provide as much information as we can to let you understand why and how we came up with these numbers. And this is part of the basis for that cost one, which is which one is higher, which one is lower. And so for a nonprofit structure, the main difference for us, based on what we believed was at the benefit rate, not that the salaries were different, but the benefit rate may be different. Our benefit rate for the city of Richmond is extremely high. And so that's really where you see a lot of that difference in the total for 12 months, for annual, or 6 months, depending on how you wanted to look at it. And we also just want to clarify, once again, we have what's called cost pool rates included, and it covers insurance for employees as well as vehicle charges and other internal services in terms of how people are using finance and IT. None of that's included if it's a city department. There's a whole extra layer that's overhead for the city, which also I know happens in nonprofits. We would have to probably do meet and confer with unions around these positions. So there's a lot of other things that would need to happen that have not happened. But these are our best estimates on what things would cost if it was a city program versus a nonprofit. And anything here? I will take that silence as a no.
Nothing additional.
But I got a lot of questions.
Oh, I'm following the chair.
How many more slides do we have?
2.
Okay, so let's finish the 2 slides and then open up for more questions.
Next slide. So just ongoing. So you have the report. It provides some recommendations or some possible options. We don't even provide recommendations. We say, here's some thinking around what are the different options. Here are some pros and cons. And we really are providing information so that task force members, community members, and ultimately the city council can make a decision about what they want to do. And then once they inform us on what option they want to move forward with, then we need to really dig deep and start to put things in place so that we can get this program up and running officially. So a few things that Urban Strategies Council recommends is a community advisory board, and Ann can speak more to that, that we would have regular meetings with service providers to make sure we are connecting people to the right places and have information. We would do more outreach and information sharing with community, make sure there's a really robust, wonderful website, and make sure people there's a mechanism for people to share opportunities for improvement and feedback on this program. Next slide, and then Ann can speak to both of these slides at the same time. We are coming back to City Council in September. Right now it is scheduled for the September 12th City Council agenda, but that agenda has not been published. We have in the budget a classification for a program manager that can help lead this work. So we would have to create the job classification and actually select someone based on that program model. We still have space on our contract with Urban Strategies Council so they can continue to help us if City Council decides they want to do an RFP. Of course, additional training and needs to happen with Richmond Police Department, as well as with Contra Costa County A3 program. The City of Richmond, along with other jurisdictions in Contra Costa County, meet with them monthly. I go to those meetings. We need to procure vehicles. We need to develop protocols, an engagement plan, referral system, data management. There's just a lot that still needs to happen, but we're definitely on the road to getting where we need to go. And those are the last 2 slides. And anything around recommendations around continued community engagement and next steps?
We have seen several communities that have really fallen down in terms of community engagement, and it has really harmed those programs. So I mean, again, it's just really wonderful that Richmond continues to have such a strong focus on community engagement, but it cannot and should not go away. And then in terms of next steps, I really think that it would be tremendously beneficial to hire somebody to begin to work on implementation so that there's one person who's assigned to it and who can kind of continue to engage with all of the departments and the county and the other stakeholders.
That concludes the presentation.
Okay, I want to open it up now to task force members for questions and also for members of the community who are here. If you have questions, feel free to raise your hand and you'll be recognized to answer. I see your hand, Don, and then after him, BK.
Thank you very much. I'm going to be brief for my initial questions/comments. We wear two different hats. One of them is a community activist where we want to make sure that the people that are going to be working on this get well paid. That's admirable. Coming from a house of labor, that's always important to me. But then if you got to wear the other hat where you're administrator. You don't look at what they're earning, you ask what is it going to cost? And there are a lot of fees above and beyond, I believe, what we were seeing here on what they were saying costs. I mean, let's just take the manager at $120,000. Okay, because you got pension benefits on there, you've got health care benefits on there, that could add 30 or 40% on there. But just basic, the employer's part of the workman's compensation and the Social Security is another $10,000 a year. So what we need to see, the city council needs to see, what is going to be the total cost to the city on implementing this? Because it has to be factored in. You can't budget only for what they're going to get on their check. You've got to budget what's going to, the total package cost on there. So I would like to see that. But I'm also concerned, and this is a question, when you're talking about your half-time clinician, where do you find a half-time clinician only going to be paid half pay that is on call 24/7? What happens when you need that clinician during those hours when that person is off the clock? If we thought about that, and is there a way to address that? Thank you.
I have an answer.
Please go forward.
I'll take the first part of the question.
Oh, hi, David. Welcome.
Thank you. Oh, well, the first part, I agree with the comment regarding the cost. And as budgets are further refined, those estimated benefit costs can be calculated more exact into terms of what they'll actually look like. But the assumptions we made and the percentages we use does include those type of costs that you refer to. It may not be exact, but the assumptions do include those. And I'll let you do the second one about the mental health specialist.
So the mental health specialist is not a on-call position. The goal of the mental health specialist is to provide support and that clinical knowledge base for the program and for the responders, and to do things like develop training and develop protocols and provide support if responders come and say, this is a challenge that we're facing in the field and we need additional support, or we have this particular situation and this Richmond resident we keep encountering and needs additional support, and we need help figuring out what to do better. But it's not an on-call situation where you're responding to a crisis in the moment that it's happening. In the moment that it's happening, you just have to depend on the crisis team to do the best that they're able to within that context. Really trying to provide somebody who's like coming in on call during a crisis, it does not does not typically work. The model of having the clinician in that support role is what they have done at Cahoots very successfully for decades. And as to the issue of hiring somebody half-time, clinicians as a career, there are a lot of people who are, in fact, they may have a private practice the other half-time, they have other, there are in fact people within that community that are looking for part-time positions. But it's not an on-call situation.
EK, I believe you were next.
Thank you. I just want to say, I think to Don's first question, on page 48, they have the breakdown of the benefits that they've actually included on there. So it does, they're very high. I guess that's a Richmond thing, but they're very high. So 2 questions, Ann, or for somebody. I still don't clearly see the handoff between, you mentioned, or maybe LaShonda, you mentioned it, A3 and the behavioral health issues, or I don't remember how you said it. But so it sounds like some events our folks would not handle, but they would be A3 handled events. I'm not sure how that handoff happens in the middle of a crisis. And the second question has to do with the cost per incident. Have you done any work on the cost per incident, for instance, how much it would cost? You know, have you done any projections on that? And could you, I don't know, do you have those numbers available yet, or are you not projecting that yet? Thank you.
Ann and David, I will let you take both of those, and I'm going to put one of our task members on the spot because they have some information around A3. Chair,
We have not done.
Shall I go first?
Well, hold on.
Okay.
Let me just be clear. So you're asking her to answer first and then go to Ann and David?
That's fine if
No,
Chris,
that's fine
yeah,
with me.
yeah,
just wanna make
I
sure
didn't,
That's what we're doing. Please.
so Kristen can share some information about A3.
Absolutely. I currently work at A3. I'm a mental health community support worker, which is a peer specialist position, and I'm also currently a registered substance abuse counselor, so I will be shifting into that once I finish my exam. But I will say one of the things that's been discussed a lot, and also I've been involved with this work from the beginning, is that if the Richmond team is dispatched and it's determined that someone's experiencing psychosis or some other gravely disabled mental, and it's clearly behavioral health, mental health, the A3 team has licensed clinicians that have the training and the ability through the county to assess someone for a 5150 hold, and that would be an involuntary hold. So that would be one instance when the A3 team could be called to step in and assist the Richmond team, because there's an issue around the person fits criteria for a 5150 hold, and that kind of assessment needs to take place. We also have access, because we're county behavioral health care, we have access to people's medical records. Not 100% of the time. Some people have private insurance and we can't access, but if they have county care, if they already are in our county behavioral health care system, and that means they're getting care through one of our county clinics, they already are linked to clinicians here in our county, or have a case manager in our county, maybe in a different public health program, we can see that in their chart. And we can, it could be after hours, but during hours, sometimes we can actually, as a county team, reach out to that clinician, inform them that their patient is in crisis and they have transportation. They can go and visit that person. They can link them to more immediate services, or we can support them showing up for their appointments, things like that. So these are ways that we can support the Richmond team. And just, I want to back everyone up, because The list, it's accurate with what Ann and others are saying, that the list of the calls, those are not A3 calls.
Right here.
Because we are behavioral health, it has to be determined that it is absolutely a mental health call, and we triage those calls as such. If the person, if they have dementia, that's medical, we can't even go out on those calls.
Thank you so much. Ann or David, do you want to add? So it was the cost per incident, and then understanding the handoff or the dispatch of between A3 and CCRP, or the dispatch of calls to A3 or CCRP.
Don't have any information on the cost per incident. That is actually one of the things we want to learn from the implementation during the initial pilot period. And the second part of the question, can you repeat?
I was just curious, and Kristen just answered a lot of that, but just curious how the handoff happens from A3 incidents.
Oh, okay.
Yeah, thank you.
Thank you. I'll leave it
So-
with.
So, I can do the handoff issue. It's not, I think that it is, a lot of times it's just going to be an issue of, let's say CCRP arrives on a scene and learns that this is a person who's already is already a patient with the county, and that the county is familiar with the person, right? And then CCRP or dispatch, depending on what protocols are developed, and those protocols haven't really been developed yet, just straight up for A3, in terms of how dispatch engages, that somebody contacts A3 and says, hey, what do you want to do here, right? I mean, I think it's just going to be a back and forth discussion. I will be very surprised in 2 years' time if there aren't moments when A3 says to CCRP, this is our call, but it's going to take us half an hour. Can you go over? And, you know, kind of stabilize it to the extent possible until we can get there. I mean, I just think there's going to be back and forth. But what Kristen is saying is really essential, which is that there are plenty of calls for everybody, and A3 really expects to continue to be very specifically focused on behavioral health, and typically among people who they know and have a specific diagnosis, as opposed to, I think that the public, if you see somebody behaving erratically in public, you think it's a mental health call, but it's not necessarily categorized that way. And I think that there's just a very broad range of calls, and that as people get to know each other, they're going to develop collaborations where that's appropriate. And that means bringing A3 in for support when that makes sense. And for A3, when they're getting calls that are not appropriate for them, I think they're going to start bouncing them back over to CCRP as well.
I also want to add that A3 does not transport as it's designed right now. We do not transport. So the only way we would transport is if we do a hold and they're transported by ambulance to psychiatric emergency in Martinez. That being said, many times, most of the time, honestly, because a crisis responder is showing up and they usually have a support person, whether that be family or friend or a neighbor, who sees they're in crisis and we're talking with that person, they voluntarily decide to get support and help, and there's problem solving and a plan set up for that. But then we don't transport. Well, sometimes they don't have money for an Uber, they don't have a friend in that moment that can give them a ride, either to voluntarily go to psychiatric emergency or go to a drop-in appointment at their clinic or some other place that they know will help them. And then that's this issue where we don't we can't give you a ride. We have to say this all the time. If our Richmond team could give someone a ride, that's huge. That's like a big deal. So.
Does that answer your questions, BK? I'm going to ask other people who have questions to raise your hand. I'm going to, I see you, Tamisha. I'm going to actually make a request of Ann and David and make one quick comment. my request specifically is, can either one of you actually walk us through a specific, give us an idea of how you envision the team working from the time a call comes through until they actually go out into the field and describe what person would be doing what in response to a call. And then my comment before you start is that I just think it's important for us to note when we're talking about cost that we're comparing to our current situation where these calls are being handled by the police. And so the whole point of the program is to provide an alternative to the current situation where the calls that come in are being responded to by police. And under no scenario that I've seen is doing any of this more expensive than having the police respond to those calls. And I'm going to ask David and Ann if you could just walk us through, and then we'll take additional questions from the rest of the task force.
Ann, would you like to do that?
Sure,
You have a
and I
real-life
just want
example.
and I just want to say in terms of the costs of the police, you know, one of the real challenges for the police is that de-escalation is about often taking the time to listen and understand what's going on and giving people the time to express what they need to express and work out what the possible solutions are. And what police will say to you is that's the thing that they don't have. They need to show up and get it resolved and move on to their next call. But, you know, it's not only the cost of police, there's the cost of arrest. And I realize it's not a Richmond cost anymore, but there's the cost of jailing somebody, there's the cost of court costs. I mean, there's a massive number of costs associated with police responding to calls, above and beyond the actual cost of having police respond. And obviously kind of the societal cost for the person upon whom any of that happens. So I call 911, or I'm a very sophisticated caller. I call the non-emergency number, and I talk to a dispatcher. And I say to the dispatcher, my neighbor is, I don't know, making noise or whatever the situation is, but we have a conflict. And the dispatcher asks a couple more questions and determines that it is an appropriate call for CCRP. And depending on what the protocol is that is developed, the dispatcher tells me, the person who's making the call, I'm going to dispatch CCRP. I know that they're available. You're not going to be seeing police. You're going to see these community responders come. I may or may not be happy to hear that. And then the CCRP team of 2 people show up. Maybe that's a community responder and a community EMT. For the moment, let's just say that it is. They show up, and the 2 of them, acting as a team, begin to figure out what's going on and engage with both me, the caller, if I'm around, and if there's a person next door who's doing something and displaying that there's a crisis. Specifically, who does what within that team is going to be very, very fluid. That's 2 people who are responding together and functioning very much as a team, even though they have 2 different job titles. So they may split up and each talk to one person. They may determine that one of the people that they're engaged with responds better to a woman, and one of the team members is a woman. Whatever, you know, they're just going to kind of do the best that they can given the situation, and they're going to work together. And the advantage of having transportation as an option voluntarily is that, let's say I am very drunk and I am downtown and there have been calls complaining about my behavior downtown. They, in the course of talking to me, may say to me, where is a safe place that you could go to sober up? And I say, my uncle. And they may decide to call the uncle to make sure that the uncle is down with this, and the uncle says, yes, they can, if I agree, they can give me a ride there. And that helps to address the situation for right then. They may also have a conversation with me about whether I have a concern about my alcohol consumption, and do I want to look at some rehab options, or, you know, whatever else in the future. They may circle back in a couple of days and check in on me, but they're going to figure out with me what the best solution is to the crisis in that moment. Is that, Deborah, what you were looking for?
Yes, thank you very much, Ann. I appreciate that. So other questions from task force members? I know Tamisha, she had questions.
Can everybody hear me?
Yes.
Or should I be closer to them? A little bit closer? All right, sure. Can you hear me now?
Yes.
Great. Tamisha Walker, task force member. So I have some reflections, because I just want to say that I heard the East County model and Antioch referenced a couple of times. I want to be very clear that every community has different needs. So I want to be clear on that. I also want to say that that model is administered by a nonprofit to administer the services, and they're under the authority and report to the Department of Public Safety and Community Resources, which is similar to the Office of Neighborhood Safety that you all have here in the city. They also work with the police department as well as dispatch and go through trainings with dispatch. And this particular department has a community engagement division that will keep consistent community engagement around the progress of this crisis response team. This team was funded at $2.5 million for a 2-year pilot, and the reason why the collaboration needed to be so close to the city is so that future funding can be sought out from other sources, because a city solely run process, this is specific to the reference to Antioch, would have taken staff capacity that we don't have and fiscal sustainability that was unpredictable. So when you talk about taking a program that isn't necessarily in a city yet, then you are talking about capacity, increasing capacity, and assessing fiscal sustainability that can potentially be uncertain, which is why it's important to have a partner. The $2.5 million startup did come from the city funds, but with a commitment from the nonprofit to help raise additional funding to keep the program going after the 2 years. Some of the struggles, the program could not launch because the county pushed back against the team having their own EMTs. And so my question is really, when I saw EMTs, was, have you all in Richmond already worked that out, or was the EMTs a part of the city-run model versus a nonprofit-run model? And then I have a couple more questions.
I will let Ann and David speak more to it, but first I want to thank you for explaining a little bit about how Antioch's program worked and why the decision for the Antioch City Council came to work with a nonprofit instead of having it be in-house. But the concern or the issues with the county EMT was brought up during the, I don't remember if it was after the report was written or right before it was going to be done. It was still a recommendation. So we have not, I have heard about it, but we have not engaged in deep conversation with Contra Costa County Emergency Medical Services, I think that's the name of the department, about this and what it would look like if we decide we still want to have an EMT. So we have not had that deep conversation, but I do know that that was an issue in Antioch for Contra Costa.
Thank you.
So
no, we did not get them. Even though we worked something out with the county to be able to launch, I'm not of the belief that we have an active EMT on that team because there were some nuances around county staff and they already having EMTs and like all the madness. So just wanted to make sure y'all knew about that hiccup and y'all were looking into that in the event Richmond wanted its model to include EMTs. I know other models have worked directly with fire departments, so Richmond has its own fire department, Antioch does not, so that might work. The other, so then the other question I had was around the categories of response for the crisis response program. And I thank you, Ann, for giving those examples because it did answer a lot of my questions. I want to clarify, when we first started the conversation, and thank you, Chair Smalls, for asking for an example, is that when you initially started to give an example, you said there was a complaint about noise. And then as we started to wrap up, you said a complaint about public disturbance downtown. And so if I'm clarifying correctly, you gave 2 potential examples. And if this was a complaint about noise and a crisis response team showed up, and I'm a savvy community member and I know my rights, the first thing I'm gonna ask that team is, are they aware of the city's noise ordinance? And then get in a conversation about my rights. And then like, how do you combat that if you don't have a legal authority to challenge it? What I will say is that Richmond Police Department over the last couple years, I don't know if folks are aware, has went through a lengthy community engagement process where there's a culture that's been created where if people make a call about a suspicious person, you gotta have a credible reason why you're calling about that suspicious person. Otherwise, you're wasting valuable city resources to respond to something that could potentially be non-dangerous, non-threatening, or racial profiling. And so how is these teams gonna deal with that? Because if they're dispatched to somewhere where there isn't a real crisis, then that could be a waste of valuable resources where they could have actually responded to an actual crisis.
So I'm not going to remember all of the points that you've made, and they're very good points, but I'm going to try to hit a couple. Yes, I was using various examples as I kind of dug myself in on my initial example. I think that the teams will become very sophisticated about what the noise ordinance is, because noise complaints are very, very frequent. And it's part of working out a problem, right? If you go to a noise complaint call that technically is a complaint about nothing that's violating anything, it's still some kind of a neighborhood disturbance that you're just trying to de-escalate, right? And so you go and you talk to a neighbor who says, I work nights and I want to be able to sleep and everybody's making noise at 2 o'clock in the afternoon. And you say, okay, I hear you, but it is the middle of the afternoon and the noise ordinance doesn't say that you can't make this noise. But you're complaining about this child party, and I've now talked to the people and they say that they're going to be done around 4. And the rental for the jumpy house is coming at 4, and things are going to settle down after that. So knowing when it's going to end, does that help you in terms of tolerating this situation, right? I mean, and that doesn't mean that that doesn't mean that it is in fact a complaint about something that's a technical or legal issue. Similarly, being able to go up to people whose party has gone past the time that they are now in violation of the noise ordinance, one of the things that you can say to them is, the noise ordinance says that you can't really have this level of noise after this hour. And the likelihood is there's going to be more problems if this continues. I don't have the, and that's not saying that you have the authority to make them stop, but it is part of trying to figure out the problem and discussing it with the people that are creating the noise. So I think that's a piece of it. The EMT issue, I have to tell you that Contra Costa is kind of unique in having this EMT issue. Nowhere else in California have we heard about the same type of issue, but here's what's really important in my mind about what happened in Antioch. They said, okay, we're having this one obstacle in terms of having EMTs, and we would like to have EMTs, and we think that EMTs are beneficial, but it's still beneficial to have a team even without the EMT, and we're gonna make sure that the obstacle doesn't prevent the program from moving forward, right? So they still implemented. Do they still wanna have EMTs if they can? Yes, and I think the hope is that it can be resolved. But in the meantime, they said, we're implementing the program, it's moving forward. Would we like to have EMTs? Yes, and we hope to have that in the future. But we're not gonna let any obstacle prevent the implementation. And I think that that is really significant. And I am curious to hear from you, Tamisha, if, you know, kind of the experience and what you're hearing in Antioch is that people are having, you know, kind of a positive experience with the teams.
I'm hearing that people having challenges with getting them to show up, but that might not, you probably in Richmond won't have to worry about that. So that's not to warn y'all off. I'm just saying it's a pilot, and so you gotta work out the kinks in the beginning because they're still trying to figure out what they should and shouldn't be responding to. And thank you for all of the clarification, and even in your example, these teams don't have the legal authority to enforce anything. But what I would encourage, and I think it's already in there around their training, is there is always great training about resident, like conflict mediation strategies to bring people together to create agreements so that they could exist together. And the hope is that these teams do follow-ups, because if we neighbors and now we got a conflict and now I know you calling because I'm playing my music, you know, how do, like we talk, you know, I'm just giving real world experiences here. So just, you know, resident conflict mediation, following up, knowing the local municipal code, and that they can't enforce, but they can potentially try to create space for a relationship to develop so neighbors can respect each other, and I'm done.
I'm going to go, okay, I'm seeing 1, 2, 3, 4, 5. Okay, I'm going to start on this end and work our way around. So that's Joey, go next.
So I just wanted to make clear, because I think what's happening in Antioch is, I think it has some importance before we implement stuff here. Just so I'm clear, did Antioch's program move forward without an EMT element because that was the hang up with the county EMS system?
Yes. The county was not having it. They would not allow our team to have an EMT.
Okay. And then I think maybe, Tamisha, this might be directed more towards you. The nonprofit element, after the 2-year pilot and the commitment from the nonprofit, what's going to happen hypothetically if the nonprofit can't come up with money? And what is there been an agreement between the city and the nonprofit as far as what amount of money the city is looking for the nonprofit to raise in order to continue the program?
Those discussions haven't been entered into yet, but it's very clear that after the 2 years, this process, this team will no longer exist without additional funds. And there needs to be a conversation about collaboration with the nonprofit to collaborate on fundraising rather than committing it to the general fund.
So I would assume, like, the city's telling this nonprofit right now, you need to get your act in order. And I'm being a little curt maybe, but.
There is an impression that we need to have as much success as possible so that we can raise other state and federal funds to continue this process in Antioch.
Okay, thank you.
Ben, you're next.
It's for Urban Strategies Council. Just a couple quick questions. Your experience has been in the state of California with these types of teams?
Yes.
Okay.
And also, we've been working with the city of Cambridge, Massachusetts.
Now, how many have been successful in the state of California?
These are all pretty new programs. We've worked in helping the city of Oakland, the city of Antioch, and now in Richmond.
Okay.
There are some other models that are being implemented around the state. For example, the city of Alameda, San Francisco, they have additional models. I think there's a challenge that many of them face in this startup period. One is the continuous learning that has to go on between dispatch and the programs operating. And two is the recruitment of staff that reflect the communities they're serving, who also have lived experience in dealing with some of these issues. But I think I haven't seen any formal evaluations of any of the models.
Sure. Sorry. I appreciate that. I'm curious, and the reason why I ask is because obviously the state of California has its own set of laws, its own responses, which is very important to how the success of some of these programs would be or will be, hopefully. When I look at these calls, on the dispatch alternative response team, the call list, I mean, I'm a police officer here. When I look at all these are all calls that I've been to many, many, many times, these types of responses. And I'm curious, so far, if there's any data on the necessity for police to respond, because it sounds like to me the hope and goal would be on the front end, people would be dispatched, these teams would be dispatched, they would not be given a choice in the matter of whether they wanted a police response or a non-police response for these, whatever agreed upon particular calls there would be. But I'm curious as how many of these types of calls, just looking at this list in particular, that if there's any data that law enforcement has still had to come and respond, and I know that's kind of been the questions too, that, obviously, worst case scenario, that we would still have to respond to these things. And I'm just curious if there's any data, anything so far gathered, I guess in-state would be the ideal, but even out of state on these types of calls, because to be frank and pragmatic, I see several of these things where it might start off great, and then they don't go so well. And I'm just curious on if that has been, we've gotten that far down the rabbit hole across the state or in your guys' experience.
Outside of some work that the Vera Institute in New York is doing on assessing some of the implementation of these new programs, I don't know in regard to the data, especially in the case of calls where it is determined that police need to intervene. Ann, do you have any in your?
Yeah, in terms of when alternative response teams, broadly defined, need police backup, it ranges from below 1% to a high of 3%, where they're calling for police backup. And that doesn't mean that every time they're calling for police backup, because it's become a serious or dangerous situation. Sometimes it's just a situation where suddenly you find out that one of the people that you're talking to wants to make a complaint that you need to file with the police, or there's some other situation is just outside of the scope of the alternative response teams. But they're very, very low numbers overall in terms of when these teams are calling for police backup. And that means that whereas police used to have to respond to 100 calls, they're now responding to, at worst, 3 out of that 100.
Is that within the state or out of state?
Oh, we just locked in, but I think that's national.
Nationally? Okay. Thank you.
And what we also can do, I'm taking down questions, and we can try and incorporate some of these responses into a FAQ that could be on the website or into the next presentation to City Council. And if there might be an opportunity to include some of that in that presentation. Thank you.
Okay, additional questions on this side of the table? I would just follow up for Ben. You might want to check out the report on Cahoots, which is the program that was started in Eugene, Oregon over 30 years ago. And it's been fairly well documented. There's a fair amount of data that's been acquired in Eugene over the time about the effectiveness of the program. I know that when it first started, it had much more police involvement in the response to calls than it currently has. But I think a lot of the questions that you're asking about that will be included in the program evaluation for Cahoots, which is on their website in Oregon. Okay, on this side, started with Kristen, then I saw Marcus, Randy. We're working our way down. Okay, great. So go ahead, Kristen.
Okay. So one of the things I'm thinking about is triaging the call and really understanding the nature of the call. I talked to every dispatch. What are there, 23 different police departments in this county? The thing about dispatch is they talk really fast. I'm like taking notes as fast as I can when I talk to someone in dispatch, whether I've called them or they've called me. Myself being a crisis call counselor, I'm the opposite. I literally have a little button I wear that says, I have time to listen. So when a community member calls me, I have a whole page of triage questions and they're also telling me the story, and I'll have like 2 pages of notes. And all my questions are safety questions. If a law enforcement calls, they're asking A3 for either a co-response, or this is clearly just an A3 call and they don't need to go out at all, I'm only usually getting the person's name, birth date, and I want to get a phone number of whoever placed the call to law enforcement, because I need to call that person and then ask all those triage questions. So our teams aren't going out until we understand a lot of collateral about that call. So that's something I don't to me, these are all sort of more implementation questions, but I don't really, there would have to be like a lot of collaboration with Richmond Police Department and with dispatch. I don't, like A3 would never just run out. We don't run anywhere. We tell everyone we're not an emergency service. If this is really a medical or, if this is really an emergency where you need someone to come extremely fast, you have to call 911. Now, moving forward, we'll hopefully to get our response times a lot faster when we're a larger program. But we get a lot of collateral. I don't know that dispatch would have to ask as many questions as the Richmond team would need to know before they go out. And a lot of those are like safety questions, like who's there, there's just a lot of questions. We want to talk to people on the scene who are already there and find out really the nature, as much collateral information as we can possibly get. Because we are also figuring out what kind of team to send out, and do we want law enforcement there or not? And then we do an information call before we show up at an address to let the police department know that our team is being dispatched and the exact location where we're going. Most of the time, we don't need law enforcement, but that way, if we do, we just call dispatch back and they know where we are already.
Thank you, Kristen. Did you have any questions?
Oh.
No. I just want to make sure.
Well, I guess that's my question for urban strategies is, how do you see triage call? Like, does our local Richmond program going to have like a phone center like that? Or are we just working with dispatch, or are we calling folks before we show up? How do you see that happening?
And,
So I'm at a real disadvantage. I'm at a real disadvantage because David and I can't communicate with each other. So usually we like look at each other and figure out who's going to say what. The specific protocols for dispatch need to be worked out with dispatch and with Richmond Police and Richmond Fire and CCRP. So, you know, this is very, very hypothetical. But the fact is that Richmond Dispatch already asks safety questions, right? And they will, because it's part of their figuring out what the priority of a call is, as well as ensuring the safety of the officer and being able to give the officer as much information as possible before they arrive. So that will continue, and that may get refined a little bit in terms of the CCRP response. Certainly, I would hope that there would also be the potential for CCRP to call, especially if there's a situation that they can't get to immediately. That's something that Eugene does, and you know, I've always heard about is like they'll call somebody and say, "This is what's going on. Can you wait 15 minutes? You know, is there?" And then they'll kind of talk through some stuff as well. So I would hope that that was part of the protocol that was developed. But we're getting kind of very much into specifics that have yet to be developed.
Okay, Marcus? My question was answered. Okay, great. Yours said yours was answered. Jamin, are you good? No. Go ahead.
Okay. So I saw that I believe Urban Strategies came up with these different options, but I didn't see any asking of the community of which of these options would they have greater faith in, like if they were being served by a nonprofit versus an actual city department or some sort of hybrid. Did we get any data of like which of it, like if they see a nonprofit and they don't think it has any real efficacy, then we end up having a program that doesn't get utilized. So I ask about that one first. Is there an answer for that?
Ann or David, do you have an answer for that?
During our conversations in interviews and focus groups, we did not ask that question directly because we wanted to get a better sense of the needs that people had for response, not get them into the structure question. But it was clear, just in comments that were made, that there was a greater degree of faith in the city doing this versus the county. And when we spoke to nonprofit organizations about the potential of a contract, there was some reluctance to bid on something that they would do for a year or two and then be moved into the city, because they'd have to staff up and then staff down, and put an enormous investment in upfront that would be recouped.
Thank you. I guess as a comment, I would say that I think that there really does need to have some community engagement about what of these options would even be viable for the communities, whether that be through the neighborhood councils or however that follow-up outreach should be done. I then had another question about how they would involve themselves with regard to law enforcement or even the legal system. It said that I saw 3 reasons why they wouldn't, why law enforcement would be involved. It was if they specifically requested it, if they've exhausted all methods of de-escalation, and I think, and then there was one more. But one of the things it doesn't play into my question, right? The thing I'm asking is, if a person, so like in the instance that in the example you gave, somebody was having public drunkenness, and then they were going to be given a ride to their uncle's place. Is there going to be a record that would then be able to be utilized by the legal system or law enforcement if for some reason they got involved in a larger incident that actually engaged him in those outside of the crisis response? And what would be the relationship of the crisis responders to testifying in court, being able to give character witness or any of that sort of engagement, or would they try to recuse themselves from that kind of engagement? I just want to make sure what their role is and what potential engagement they're going to have in following up with some situations that may be ongoing and outside of the ability to quell.
So, the specific protocols will be developed for Richmond. I will tell you that the folks in Eugene, Oregon, they have been called to testify on occasion. They've been in situations that ended up in court situations either because of lawsuits or criminal actions. I think that generally they're pretty sophisticated about not wanting to get information that could compel them to testify. So if they come to me because they're helping to resolve a situation and I start talking about how I was driving a car earlier and there was an accident and I drove away, they, I think, try to avoid getting information that would put them in the middle of that situation. Their goal is to define a scope of practice for themselves that is very separate from law enforcement, right? They're there to resolve crisis with community, and that and there certainly have been times that they've been called on to testify, but their goal is for that not to happen, and for the police, and Eugene police really do have a pretty profound understanding of this, that they have a separate scope from law enforcement, and they try very hard to keep kind of some level of a barrier there so that the community knows that they can engage without feeling like it's going to meld into law.
Yeah, I think just as a comment, I think that would be something that should be addressed, is the perhaps perception there could be of case building. And so I would just put that out there.
Tamisha, and then Don, and then I'm going to ask.
It's going to be really quick.
And then I'm going to do a time check after Don's question.
Thank you for those questions. It's supposed to be a non-police response team. I don't think we're trying to rebuild another police department. I do have a question. So I know there was, and maybe this is for you, and forgive me if I just missed it in the report. Oakland had challenges with its model around hiring in community and from community when it came to people with convictions. A lot of the pushback came from the PD. How were you all able to resolve any of those issues in Oakland, if any? And are there any perceived challenges that might exist here in Richmond?
I would say that the challenges are not resolved in Oakland, but we're still working on them. The Oakland team is within the fire department, and that has created some challenges in terms of the background check that the fire department is using to hire for the teams, even though they're not regular fire department employees. So that's been part of the problem. It's just not, it's not resolved, but we're still working on it. But yes, that can occur. It can occur. I've seen it occur. Honestly, sometimes it seems like it's easier for nonprofits to hire people, you know, and consider kind of the totality of their experience and how it's going to benefit the program than it is for cities and counties to do so.
Thank you, Ann.
Okay, Don Gosney.
Thank you, and I don't want to sound like I'm beating a dead horse, but my comment in a few seconds may have an impact on the recommendation we make to the council. I want to thank BK for pointing out the chart that included the benefit packages and the cost of the benefits on page 48 of the agenda packet, where you've got essentially two sections of the table. One is for the nonprofit, the highest ranked choice in the previous table, and the other is for the city. But the cost for the benefit package, when you exclude fixed rates like Social Security and state disability, it's 2.66% higher for city employees than it is for the nonprofit. This suggests to me that perhaps the nonprofits are not unionizing. I've never liked the idea of farming out city work to contractors and vendors that are going to be working for people non-union or at a lesser union than what they would be paid if they were working directly for the city. That's just 2.66%, that's, or 266% higher. That's a tremendous amount of additional cost of the benefit package. And that's something the city council has to keep in mind, and I strongly recommend that we ensure that they, whatever selection they do, that they go with union workers.
Thank you, Don.
Nonprofits also hire formerly incarcerated people, which cities struggle to do. So the access is different.
Okay.
I encouraged Oakland when they were considering going for a nonprofit to put into the RFP something about card check. But then they went to the city, so it didn't matter. But I mean, you know, I think you could do that.
A card check, but meaning
Union
not
card.
checking, yeah, okay. I want to do a,
Card check means that if the employees want to unionize, they sign a card, and then you get a neutral person to come in and confirm that a majority of employees have signed union cards, and the union is automatically recognized by the nonprofit.
no worries. Okay, now, I want to ask any non-task force member who's here in the room, if any of you have any questions that you'd like to pose to the two presenters from Urban Strategies Council that relate to the proposal that we're discussing.
If anyone does, please raise your hand. You'll have 2 minutes to speak on this topic. I don't see any hands raised for public comment.
Okay, no public comments, wonderful. Okay, well, that's not wonderful, but I'm just time check.
All right.
Okay, so we're now at 7:21. Our agenda was for us to both discuss the proposal and also look at making recommendations to the city council about the proposal that we've been given by Urban Strategies. So my first question to the task force members, are you all ready today to be able to vote on making recommendations to city council around the proposals that have been put forth in this document?
No.
Can I, by a show of hands, if you're not ready to vote today, just raise your hand. Okay, so that suggests to me that the majority of us are not yet ready to do that. My suggestion is that we actually have an additional meeting before the city council meeting on September 11th, or September 12th, I think you said they're meeting, on September 12th, to actually, I would make it a special meeting specifically to discuss these proposals, and for the purpose of us making recommendations as a task force that we would then convey to city council before they hear this item on September 12th.
Chair, a question?
Yes, Ben?
Do we know for sure that it's going to be on the agenda for the next go-round, or maybe I missed that, sorry.
Yeah.
It is, because it was held over and wasn't heard at the July meeting, it is currently on the agenda. But once again, the agenda goes through a agenda review process with the mayor and members of city staff. And so the official agenda has not come out yet, and we won't officially know what items make it. But it's supposed to be on the agenda. And if there is a special meeting and you want your recommendation included in the written report that staff presents to city council, you have to have my true deadline for this agenda is, I have to have it out of what's called my queue into the next department on Monday, August 28th. I have a few days to get into the system to make a change, probably up until the 30th. After that, the agenda is posted on the 31st. So you could have a meeting and I just have to verbally say something if it's before the meeting. I just want you all to know kind of what or maybe I'm missing, I'm sorry, I missed a whole week. The agenda is published on September 7th, I apologize, and not the 31st. So you have, I still supposed to have it out of my queue on the 28th, but I do have that whole week to try and get some changes in. So just wanted to let you know.
And what I will say is that I do know that this item is a priority of several members of the city council. So if there's any way for them to be able to address it at the next city council meeting, my assumption is they will. But either way, it seems to me that it would behoove us to have decided on how we feel about this and what we want to communicate to city council about this before the next meeting that they have, that this would be on the agenda. And if for whatever reason they don't get to it on the 11th, we at least will have done our job with respect to that.
What a good idea. It really is. Yeah.
So, first of all, are people in agreement that we should meet again before the city council meets on September 11th?
12. Yeah, still the 12th.
I'm sorry, the 12th. I got a September 11th in my mind, I'm sorry.
It's my birthday.
Okay, I apologize. Thank you for the correction, Don. So my suggestion would be that we look at meeting either on, today is the 23rd. So it literally would either be the 30th or the 6th.
Sorry, LaShonda pretty much says she needs the.
No, in order to have it written, that it's not a given that we have to have a written presentation to the city council by that meeting. It would be ideal, but it's not necessary. What's necessary is that we actually find a date that the majority of us can be present and actually meet and make some decisions before the city council meets.
Yeah, I can always add it to a PowerPoint presentation. I can always speak to it during the meeting on the 12th if I get it ahead of time. And as a task force, something could be written and provided to city council as well prior to the meeting.
So since we normally meet on Wednesdays, my assumption is that we should have our special meeting on a Wednesday. So the two dates that are available for us would be Wednesday the 30th or Wednesday the 6th. I can do either day. You all let me know which day is preferable for the majority of the folks in the room. Randy, I see your hand up, and then I'll go to you.
I will be out of town on the 6th, so I only can do the 30th.
The 30th.
Unless,
All right, hold on. By a show of hands, let's do it this way. By a show of hands, how many people could make a meeting on Wednesday, August 30th?
That's 9.
9, and we're missing a few people. Okay.
I'm not raising my hand only because I don't know my schedule. Because school board meeting's going on right now, and I got important presentations. I'm trying to look up when their next meeting is.
Got it. But will you try to be here if you could?
Well, I don't miss meetings.
Okay, great. Okay, great. So I want to entertain a motion for a special meeting on Wednesday, August 30th.
I entertain that motion.
No, I'm asking for a motion.
Oh, yes, so moved.
Second?
Yes, Steve?
Steve seconded.
Second.
I'm sorry, what date did you say?
Wednesday, August 30th, a week from today.
My next school board meeting, aside from the one tonight, is not till the 6th.
So you can do that.
So I can do next Wednesday.
Okay, great. So it's been moved and
Hooray.
second. Can we call the question? Sorry, discussion. Does anyone want to discuss this?
Public comment.
Yes?
I will just add that we'll need to check that this room is available on that date. So
Plus, we have 3 minutes.
We'll find a meeting space for you.
And could we find an alternative space if we had to?
Yes.
Okay, because to me, I don't care where we meet. I just care that we meet. Okay.
Can we do
Any
a vote before?
additional discussion before we vote? Any public comment on this before we take a vote? If you have a comment, raise your hand. You'll have 2 minutes to speak. I see no hands. I see no, okay, let's call the vote, please.
All right. Steve Bischoff?
Aye.
Helen Burks?
Aye.
Don Gosney?
Aye.
Randy Joseph?
C.
Kristen Killian Lobos? Yes. Marcus Senjasing? Yes. Jamin Purcell?
Yes.
Joey Schlemmer?
No.
Deborah Small?
Yes.
Ben Terrio?
Yes.
Tamisha Walker?
Yes.
BK Williams? Yes. Okay, so the motion passes with 11 ayes, 1 no, and 5 task force members absent.
Thank you all very, very, very much. And my main request is that everyone actually read through the report. I know it's long, but read through it. Become prepared with any additional questions that would stand in the way of you being able to make recommendations, because I would like for us to leave the meeting with what we're going to tell City Council about what we feel about the report. Yes, Jamin, and then Steve.
I just want to clarify that if, since we're only going to have 1 week and we're not going to be able to have further engagement of the community after having this report done, no recommendation is still an option, not just a lock-in of one of those. Is that correct?
Yes, we could agree. We could decide to make no recommendation at all.
Thank you.
Steve?
Yeah, I don't know, did everybody get a copy of this answers to the question, a lot of the questions people have been raising?
Oh, here.
If anyone didn't
There's
get,
an extra one here.
we've tried to pass them out beforehand, but these are drafts of questions submitted.
Can you email those as well?
We can also email them, yes. We will include them.
Because
Everything, the slides, the report, everything.
Everything will go back out, and because this is a special meeting, items don't have to go out until 24 hours before, but we'll try and do better than that, of course, because this is, well, we'll talk to the chair for the agenda.
And
Thank
two
you.
quick things. Well, first, quick question, Stephanie. Is there any other agenda item that was on the agenda that we missed?
Yes, there was the discuss and approve assignments to City Council monthly reports for October, November, and December 2023, as well as the process for substitutes. And then there was also discuss a general outreach plan to increase public awareness of and participation in task force meetings and approve recommendations.
Thank you. Now, Jamin, are you still on to do our report for September?
Sorry, what was the date for that?
It'll be September 12th.
Oh, yes.
You volunteered the last. I just want to make sure. Okay, so then that's handled for that.
I don't think we voted on someone to.
We didn't do October and November. We only dealt with that 1 month.
I don't think we did September because we originally were gonna.
No, Jamin
Can we?
volunteered at the last
okay.
meeting to give the
My
next
apologies.
report. I'm just making sure that that still stands.
I'll be there.
And we'll carry over the next agenda item to the next regular meeting, not to the special meeting. The special meeting will only address this proposal, and the other agenda items will come on our next regular meeting, which will be the fourth Wednesday in September. One last thing, and this is not on the agenda, it's a request I'm making. I think we need a better name for the program, so please try to think of something. I have some suggestions, I'll run out real quick. SAFER, Safety Alternatives for Everyone Richmond. SAFER, Services Are for Everyone Richmond. I'm not attached to any of that, but I do think we need a better thing than CCRP. So folks, think about that and come with some ideas for our next meeting. Okay, I think barring any other comments, does anyone else have any other comment they need to make?
We're over time. We're over 2 minutes.
Oh,
We're
okay,
done.
we're adjourned. Thank you.
Good night. Take a snack.